All right. Recount. So all is good. So the chair will call the meeting to order, and we have how many total present, please?
Including online.
Yes, total present. We have 16 members present. We have a quorum. We can conduct business. So we'll go to our first item, and that is 2A, and that is request approval of a request for proposal for the adult sexual assault services. And in your packet, that is 2 through 15. And I'm going to turn this to Mr. McCall.
Thank you. So this is a little bit different than some of the other things we have done in BHCC in the past. We're sending this, this is the only proposal that we received for our RFP request, which again was for $100,000 over just this 1 year. This is to provide some stopgap funding for adult sexual assault services, and I want to set the stage a little bit for the process we followed in bringing this to BHCC, because this is something that we haven't done in the past. And so this was something that was raised as a community issue, that there were entities that had lost funding related to adult sexual assault services. We had that organization, YWCA Stepping Stones, that had raised a flag for this need in our community present at BHCC in our third quarterly meeting of last year. During that presentation, we were able to ask questions about this need and establish that the services offered by YWCA Stepping Stones were unique to this community and not duplicated by other services offered by other organizations. It was at that time that we reached out to our partners to determine if there was potential funding for these services. And this need comes out of a 60-plus person backlog currently through Stepping Stones that are not receiving services related to rape and sexual assault in a timely way, in the way that it's needed in this community. And so we've raised this issue and presented an RFP, and now wanting to receive feedback on the potential funding of this project. We are looking to make a request, or I'm sorry, a suggestion, what's the term that I'm looking for? Recommendation, thank you, it is early. A recommendation to move forward with this proposal.
And I will need a motion. Motion by Member Reese, a second by Member McCarthy, and discussion. All right, this again is a recommendation that will be sent to the executive committee of the county board, and they would then make the final decision. However, this committee has a lot of weight, so just wanted you to all know how important your desires and opinions are. Seeing no discussion, all in favor of this request for the adult sexual assault services, say aye.
Aye.
Opposed? No opposition. That motion passes. Now we will go to 3A, and that is review and discussion of services request submission of the fused psychiatric provider. So this is, we will need a motion for that. Excuse me, this is just an information. So Mr. McCarthy, McCall, I'm going to ask you to talk about something you're not quite as familiar with, but Mr. McCall.
Thank you. So this will be a much shorter meeting than I kind of thought it would be. It looks like there wasn't much discussion in our first item. The second one in here is obviously not something that we're voting on, but just proud to bring to BHCC here and wanting to continue to be transparent with our BHCC members on what we're working on. This comes out of several presentations to BHCC and across the community in an effort to keep some of our shared sales tax money more local, looking for a psychiatric provider for our fuse program that could better fulfill our needs and do it in a cost-effective way as well. So we had one submission for this. It was Carl. And we're very pleased with the submission, looking for other feedback from BHCC as well, which is why this was sent out, to see if there were any additional comments on this contract or any other sort of things that needed to be heard out by this body. But wanted to present it so that everyone could see the availability of these services and where our FUSE program will be transitioning to.
And we have open discussion. Ms. Reese?
I have memories that we've had difficulty finding psychiatrists for this community. And so this looks exciting and progressive. And so I know that Angie McLaughlin is here and maybe can comment on their process and where they are with finding psychiatry services.
Yeah, sure. Thank you. So at Coral, I mean, this FUSE program makes perfect sense for us. It lines with our community initiatives and drives. We have been recruiting more psychiatrists, so we have availability right now. The high utilizers and the FUSE folks are exactly who we need to be serving and making sure that we're working as a system. We have 5 adult psychiatrist providers right now on staff. I have 2 MDs, I have 2 nurse practitioners, and then we just hired our most recent nurse practitioner that's part-time, so she's going to be part-time inpatient, part-time outpatient with us to bridge that gap from the hospitalization to the outpatient setting. And then we're currently getting ready to send an offer out to another one, so we'll have another one hopefully on board by fall. This FUSE program will kind of focus with 2 providers, 1 nurse practitioner with 15 years experience in this community to see the FUSE patients, and then have a clinical lead with Dr. Rachel Inman, who will oversee the program. So really excited about it and happy for this expansion for us. 5 in one building.
Wow.
5 in one building.
5 in one building.
Unheard of.
That's unheard of in this community,
Unheard of.
Yeah,
Great.
we're getting there.
not just on a screen, but actually live.
I have 2 on the child side are on screens, because we also have 3 child providers that are prescribers. They're on screen.
We need, if, Sonia, can you turn your microphone off? And Angie,
could.
please turn yours on. Thank you.
Yep, yeah. So Kevin, to answer your question, we have 2 that are on screen. They're virtual providers for our child and adolescent psych, and then we have 1 provider in-house for a child. Yep.
Any additional comments or questions? Yes.
Yeah, Angie. I see the breakdown of the fees, psychiatric patient visit time. What do you expect that? What do you expect that visit to look like? How long, et cetera?
So right now for our adult providers, we have a 90-minute first initial visit. So that's 90 minutes with the provider, goes over a really, really complex and detailed assessment. Follow-up visits are anywhere from 15 to 30 minutes, depending on complexity. We can have some that go up to an hour. For this program, we intentionally left it pretty wide open, whether or not those are video visits, whether they're in person, and we'll just leave that up to the FUSE program workers and our staff and patient to determine what that looks like.
Do you see these visits being primarily med management, or will there be counseling or some type of psychotherapy?
We do some psychotherapy with the prescribers, with the FUSE program and the additional services and that wraparound they have. If we find a patient, and I know the FUSE program already does that, but if we find a patient that we're seeing for psychiatry that needs additional services, whether that be psychotherapy, local groups or something, then we'll work with the FUSE program to collaborate what that looks like for the next referral.
Thank you.
Yeah, just to follow up on that, one of the things we found particularly enticing about this new proposal was kind of the expansion of available services that might be able to be tacked on for our FUSE clients. And that includes more in-person involvement than we were used to through our last contract, which was with Genoa. So this transition is very welcomed, and I think we're going to have some greater services, a greater level of quality of services for our FUSE clients, and we're very excited about that.
Yeah, I'd just like to commend Carl for stepping forward on this. They're really becoming a very strong community partner in many different ways, both adolescents and adults, so thank you.
Yep, absolutely. And one of the things with this program I was putting in the budget with hope that we could get it was that consultation time, to have the weekly consultation time with our team and the Fuse team to help do some of that care coordination and management between appointments.
We're just trying to get timing on when this would come to you all, and we think it will be in March, and then it would go to the executive committee should it pass here for approval. If all of the paperwork and the contract is reviewed and adequate, then we would see you all voting or having additional discussion and a vote in March, and then take it to the county board and also in March. Additional questions or discussion? All right, I see none. Speaking of March, the next meeting will be Friday, March 8th at 7:30. And that's what business I have. Do you have additional?
Yeah, I just want to make one last introduction here. As you know, Sarah Stalter, our assistant director, has moved to work over with Bridge Academy and the Regional Office of Education. And so we've been able to retain someone that we think and have witnessed having a lot of talent in our department, and that's Marita Landreth, who has stepped up into the assistant director role. We're incredibly happy to have her and be able to keep her on our team. Very excited about what she's going to contribute to the Department of Behavioral Health Coordination and the McLean County as a whole. So just like to welcome her to the team in her new position and introduce her to all of you today.
Welcome aboard, and thank you so much for taking the challenge and helping our county and the needs that we have here in McLean County.
Thank you. I'm excited to kind of change my capacity. I was the Fuse nurse. I guess I'm still technically the Fuse nurse as of right now, doing a little bit of both. But I'm excited to be able to contribute on kind of a level that's higher up in the stream, so to speak.
And lastly, I just want you all to know that I'm going to be reaching out to have small meetings with maybe groups of 2 and 3 to really pull together so you all can share a little bit more intimate information with me. And so as I reach out to you to schedule meetings, know that it's really a meeting that I want, I think Chairman McIntyre also had these small, intimate meetings, and I think it's important that I do that same to get a better understanding, and for you also to know my support of the mental health initiatives here in this county. So please look forward to having those meetings, and I certainly look forward to meeting with everyone. And we can certainly, I like personal meetings. However, if online meetings are the only way that we can make that happen, we certainly can do that also. Seeing anything else, any other business? Member Jontry.
More of an announcement. I just wanted to make the members of the coordinating council aware that we are going to have an open house at Bridge Academy on Tuesday, the 20th of February from 1 to 2:30. So if you have the opportunity to come out and take a tour, we'd welcome you to come during that time. It's a Teacher Institute day for us, so the students won't be there, but staff will be there, so it'll be an opportunity to talk to staff. So if you can find your way over to Jacobson Drive, we would love to have you visit. Thank you. 1 to 2:30.
1 to 2:30
p.m. I guess I didn't need to clarify that.
Any other comments? Seeing none, this meeting is adjourned. Thank you so much for attending.